Good afternoon, dear students. Today in this session, we will be discussing about impacted tooth and its management. So, what are the contents included in it? It starts off with introduction, definitions, and the normal tooth eruption pattern. What are the terminologies associated with this impacted tooth? Then, what are the commonly impacted teeth? Then, theories of impaction. What are the etiology of an impacted tooth? Then what is the indication and contraindications for surgical removal of impacted teeth? Then we'll be specifically mentioning about the surgical anatomy associated with different impacted tooth, classification, then pre-operative assessment, then what are the surgical technique for the removal of impacted tooth, then complications, what are the recent advances. So we'll be starting off with a small introduction. Although the scope of oral and maxillofacial surgery has expanded in many directions, still in our times, the practice of dentoalveolar surgery is the mainstay for an oral and maxillofacial surgeon. So the atraumatic removal of impacted teeth is one of the most commonly performed surgical procedure in the specialty of oral and maxillofacial surgery. So, and according to Burge in 1995, he has shown in a study that complications after the surgical removal of impacted teeth has increased fourfold if it is done by a general practitioner compared to an oral and maxillofacial surgeon. So it was George B. Winter who, more than anyone else, helped to rationalize the technique of removal of impacted mandibular third molar. So got their name wisdom tooth from the age during which they erupt, because usually at the age of 17 to 25, that is a normal age group where our third molars used to erupt. So that is why the name wisdom tooth. So this is the age at which men and women become adults and they presumably wiser. So a Latin word impactus means an organ or structure which, because of an abnormal mechanical condition, has been prevented from assuming its normal position. Okay. So according to Webster, an impaction is the wedging of one part into another, and the medical dictionaries applying the word to dentistry mention that the lodging of a tooth between the jawbone and another tooth. So according to Rounds in 1962, impaction is a condition in which the tooth is embedded in the alveolus so that its further eruption is prevented. According to Archer in 1975, impacted tooth is the one which is completely or partially unerupted and is positioned against another tooth or bone or soft tissue so that its further eruption is unlikely. According to Little in 1979, an impacted tooth is the one that has failed to erupt into normal functional position beyond the time usually expected for such appearance. Then according to Anderson in 1997, impacted tooth is a cessation of the eruption of a tooth caused by a clinically or radiographically detectable physical barrier in the eruption path or by an ectopic position of the tooth. According to Peterson, an impacted tooth is considered impacted when it has failed to fully erupt into the oral cavity within its expected developmental time period and can no longer reasonably be expected to do so. Then, according to American Society of Oral Surgeons in 1971, an impacted tooth is which has already passed chronological age of eruption and failed to come to oral cavity in spite of normal eruptive forces due to some mechanical obstruction. According to WHO, any tooth that is prevented from reaching its normal position in the mouth by tissue, bone, or another tooth is considered as impacted. So all these definitions suggest some way or the other the similar condition, but according to different authors, the pattern is different or the definition is different, but everything refers to the same. Then tooth eruption. So what are the different stage? There is a pre-eruptive stage, intraosseous stage, mucosal stage, pre-occlusal stage, and maturation stage. In that, what are the eruption mechanism involved in it, and what are the structures resisting eruption during the time? So that is given in this table. Okay. Then development of third molars. So usually what happens around 7 to 8 years, there is initiation of tooth bud formation. Around 9 years, there is tooth germ visible in the radiograph. In 11 years, there is completion of cusp mineralization at the anterior border of ramus. Around 14 years, there is crown development completed. Around 16 years, approximately 50% of the root is developed. In 18 years, root development is completed. To 20 to 24 years, 95% of lower third molars erupt. So there are different terminologies associated with the impacted tooth. There is impacted tooth, unerupted tooth, and malposed tooth. So these three terminologies are different. Okay. So what do you mean by an impacted tooth? An impacted tooth is a tooth that has failed to erupt completely or partially to its correct position in the dental arch, and its eruption potential has been lost. So when you can call it as an impacted tooth is only when it fails to erupt into the oral cavity and its eruption potential has been lost. Okay, so in that condition only we can call it as an impacted tooth. There is a similar terminology, that is an unerupted tooth. People may think both are same, but both are different terminologies. So what is an unerupted tooth? An unerupted tooth is a tooth that is in the process of eruption and is likely to erupt based on clinical and radiographic findings. So unerupted tooth is likely to be erupted in few months or few years in the oral cavity, whereas an impacted tooth has no chance to erupt into the oral cavity. A malposed tooth is a tooth unerupted or erupted which is in an abnormal position in the maxilla or in the mandible. So what are the commonly impacted tooth? The impacted teeth which are seen in the following the order or frequency. So first thing is a mandibular third molars. Then comes your maxillary third molars. Then third one is your maxillary canine. Fourth is your mandibular premolar. Fifth one is your maxillary premolar. Sixth, your mandibular canine. Seventh, maxillary central incisors. And the last, maxillary lateral incisors. So these are the two which are commonly seen impacted.